All right, I have the pleasure of introducing you to three panelists who are very generous and kind to share their story with us. So we'll have a very brief intro, and then we'll jump into some of the questions so that you get a sense of what was helpful and surprising to them in their journey. So I will start with Pierre. I don't know if you can hear us. Your
I
cam,
can. I can
you
hear
can.
you.
Okay,
I,
great. I think your camera switched off as we moved in to the stage. If you can turn it back on.
Mhm. It's going through a process here to get me back on.
Okay. Well, maybe I'll shift. The first person is that I see is Michelle. So, do you mind sharing your name, where you're tuning in from, and where you're at um, in your treatment or post-treatment?
Excellent.
Yeah.
Moi, je m'appelle Michelle Bayou. Hi, I'm Michelle Bayou. I'm in Winnipeg, Manitoba. Where am I at in my process? In 2022, in April, I was diagnosed with, and let's get the technical words right, triple negative invasive ductal carcinoma. Anybody know what that is?
Yes.
It's just breast cancer. I don't know why we have all the fancy words, but yeah, I love the emojis, by the way. If you're interacting and you like this, just do the emojis because we can see them. It's so cool. So yes, when I was diagnosed, I did all the treatments, did all the chemo, did the surgery, did the radiation, did the immunotherapy, um, all kinds of experiences. And wow, we've been through it all. So where am I at now? In 2023, October, that was 1 year ago, I was said, hey, you're cancer free. So I'm 1 year cancer free now. So I did all my treatments 2022 to 2023. And woo, this is where I am in my process.
Okay.
Thank you.
Thank you. Thanks for being here, Michelle. Pierre, would you like to go next?
Bonjour. Hello, everyone. My name is Pierre Lechevet. I speak French, English, and I understand some of the traditional languages they speak in Manitoba here a little bit, especially the prayers. I'd like to acknowledge our elder who opened the ceremony with a prayer today to help us on our journey. I appreciate that. And I'm from St. George, Manitoba originally. I live in Gull Lake, just north of Winnipeg, up Highway 59. And yes, I've been diagnosed with colon cancer, stage 4 T2M. And I had a tumor in my colon that sits on the back of my vertebrae and a little bit in the front of my seminal glands. And I was prepping to go for surgery in February. And I was really like a roller coaster there of what was going to happen, worst case scenarios, and all that. And then this week, I got news that they wouldn't do the surgery. And just that I was, things have changed through the intensive radiation and chemo. All of a sudden now I have spots of concern on my liver, which changed my diagnosis to, well, if I go through upcoming chemo, I have 18 months to live. And if I don't, I have 6 months to live. So that's what I was told this week. And I'm pretty sure I understand it quite clearly. So it's a roller coaster,
Mhm.
lots of information. And yeah, that's my story.
Well, thanks, Pierre. We're glad you can make it, and that is a lot of information to absorb, and a new reality that sets in. Yeah.
Yes.
Well, thank you, and thanks again for agreeing to share. I think it's very meaningful for people to hear from all kinds of experiences. And finally, last but not least, Julie, would you like to say a few words?
Sure. I am Julie. I live in Winnipeg. I was diagnosed 17 months ago with pancreatic cancer stage 2. Very fortunate that it was stage 2. Had surgery and then 6 months of chemotherapy, which ended 8 months ago. And I am doing well. So very, very, very fortunate, I feel.
Thank you. Well, thank you for being here. I'm going to shift into the questions that we had prepped, and anyone feel free to answer, and we'll try to get to everyone. I was wondering, was there anything that was surprising to you at the time that you received your diagnosis?
I can go ahead.
Sure.
Surprising is I'm fit. I'm able to jog a marathon. I work out. I work as a commercial industrial refrigeration, and it's lots of physical work. My body still feels young, and I hear of a lot of cancers going around and people getting sick, and it's generally, well, not me. So that was a surprise. And then the shift in diagnosis, that was a surprise.
Yeah.
So there's been a couple real big surprises there. And the biggest surprise was the negative media I see pertaining to our medical system. I pay taxes, I pay into insurance, and I generally haven't used the system that much. But when I went there, the Interlake, Selkirk, HSC, basically they saved my life. And they come together as a team. I've never felt so better tended and cared to. And sure, there's lots of waiting periods and questions, but very professional, thorough, and I was surprised at the care, how professional and thorough it was, and how they tended to a very difficult situation in my time of need.
hmm Okay, so it sounds like what you've experienced has been very different than what is shown in the media or what's reported on.
Absolutely. It's like,
Yeah,
wow, what are you guys complaining about? This is like first class.
I'm glad to hear you had such a great experience. And absolutely, to your first point, that it's so surprising when you feel like healthy, good, and strong in your body. You're using your body on the job, on your time off, personal achievements, running, everything. It can kind of sideswipe you to hear that there's something so serious going on.
I need to clarify and say for those going through radiation and chemo, it's not easy and it's terrible, but I don't mean to dismiss that because I
Mhm.
went through it and I know, and it's rough,
Yeah.
but you got to work through it. It took me all my life to get sick to this point. It's going to take me some time to heal if I'm going to pass this. And although they're saying I may not, I tend to differ.
Thank you, Pierre. It is really difficult. Yeah, I'm glad you're not sugarcoating any of it. Um, Julie or Michelle, is there anything that was surprising to you at the time of your diagnosis?
I can go. It was very surprising to me when I got the diagnosis because, like Pierre, I've been healthy and fit all my life. I've never been ill at all, and so it was a shock to hear those words. And I think what goes through your mind at the time, or what certainly went through my mind, was okay, here it is. This is what we all come to face eventually.
Mm-hmm.
This, that we're all going to die at some point. And so, of course, that's the first thing that I was surprised hit me. And then it was getting past that and getting information forward. I was also very surprised at how quickly that the health system reacted, that I was able to get in to see a surgeon, that I was given lots of information to make decisions with, and just the help to tell my family, because that was the most difficult thing to do.
Mm-hmm.
Yeah.
And you feel like there were people there to help you through that.
Absolutely. Everybody was very kind, took my concerns seriously. I felt as if I was looked after, but also that I was given options.
Mm-hmm.
Yes, and lots
that
of
matter
information.
so that you can make decisions that matter to you.
Absolutely.
Okay.
Yes.
Well, that's great. Thank you, Julie. Finally, Michelle, is there anything that was surprising to you at the time of your diagnosis?
I'll reinforce what both Pierre and Julie said. I was not expecting the circle of support with the healthcare system to be so, I don't know what the word is. It was almost like unbelievable. Because you're right, we hear messages about, oh no, healthcare is like hurting. Well, maybe over it all it is, but let me tell you, the CancerCare system in Manitoba, top notch. We just had so many loving, kind, wonderful people and in so many capacities to help in whatever way we wanted. So that did surprise me. It was not what I expected. And so I want all of you who are going through this in whatever stage or whatever point, whether you're family, friends, whether you're the patient, whoever, take full opportunity. Do reach out and just, this is your time. This is our time to get all of those supports and to make use of them. There's so much. The other thing that was surprising to me, for me, it wasn't that I I kind of had a premonition. I kind of knew that I was going to get a diagnosis of cancer. Sometimes we have these feelings, these senses that we're just kind of slipping into a sickness, right? I was anxious. Things weren't going well at work, and I had family difficulties. I had relationship difficulties. All these things were happening, and I'm like, I just felt like I was slipping, getting sicker and sicker. So that part wasn't really the surprise. But yeah, definitely the circle of support, that was beautiful and that was intense. And I recommend you take full advantage of just embracing this time for your healing.
Thank you, Michelle. And I know that it can be really hard for some people who are used to being the ones who are caring for others, to then be flipped in that seat and to have to be comfortable receiving the help and the care.
Absolutely.
Yeah, thank you all very much. And that's so interesting that it was surprising that it confirmed a premonition that you had more so. Yeah. Okay.
Yeah, the surprising part was, well, maybe that I wasn't told my prognosis. Probably, I'm assuming most people are told their prognosis, their stage and all that. My surgeon, I specifically asked her and she said, it doesn't matter what stage you're at or whatever, that the treatment is the same. You're going to go through this treatment regime. Canada has just approved a brand new one for triple negative. You'll be the first. That's top notch, top of the line, whatever. Like you get the best like support and intervention that there is. And it didn't matter what the prognosis was. I went through the treatment and I did my own work. And then this is where I am now. And it can happen. Pierre, I'm hearing you, right? Like we tend to hear that people get prognoses or diagnoses or times to live and all that. And I think you have a wonderful attitude about healing, and we can just let things be as they're going to be, and anything is possible. Optimum outcomes, optimum possibilities. You're open. We're all open to those things.
Thank you. So in your case, it was probably, do you feel it was helpful to not know that?
Actually, yeah, it kind of was, because I didn't like get myself all worried and anxious about it. Like, let me tell you, I was worried and anxious. I was not doing well. I was struggling. Like you guys said, treatment is hard, and hearing this news is hard, and my life was collapsing. I like the surprising part, I thought that I would like reach out for people, and I actually ended relationships. I'm like, no, I'm done. I need to focus on me. All my healing energy has to go on me now. So that was a complete shift. And so yeah, I love that. Put those hearts up, keep the hearts going, you guys. This is your chance. that you take that opportunity to have that all that healing time, that focus for yourself, and
Mhm.
like that is just so key.
Thank you. Okay, I'll shift to our next question. Um, was there anything that you wish you could tell your old self?
Would you like
So
me to
that could
go?
be, sure. Go ahead, Pierre.
Well, first and foremost is our health and safety program has come a long way about exposure and chemicals and workplace safeties and hazards. And if I could tell some of the youth that are working with chemicals in the workplace, safety is first and foremost. And we have obligations to follow protocol here in Manitoba, and that's respirators, gloves, protecting yourself from chemicals, from hazards, and uh, aging myself. But back in the 70s, we didn't have uh, that mentality and that way of thinking. Things have progressed for the better, where the youth are forced to fill out safety forms and use safety equipment, and there's a lot of chemicals, work hazard chemicals that we expose ourselves to that we could protect ourselves from. So that's first and foremost is just use the proper PPE, and it takes a couple extra minutes, whatever. Your managers in the workplace will never be upset about that because it took you longer to do something because you're concerned about your health or your safety. So that is something I wish I could tell myself. The other thing is the likes of whether it's I don't know, Bessel Vandercook or Gabor Mate, people who are coming about and working with health professionals, doctors, surgeons, and we're talking about well-being, and that sometimes is our personal emotion, the repression of anger, not dealing with emotions. I mean, there comes to a point where your body's going to say no. The body is a powerful tool, and we have to feed it properly. We have to take care of it, and that means emotionally and spiritually as well. And that is so important. Is to be able to articulate yourself when somebody asks you how are you feeling, and if you don't know the answer to that, well, there's probably something wrong. Like
Mm.
it should be first and foremost to be able to express that how you are and how you're feeling. But when you're raised when you could work what your way through everything, and that's just the way it is, or I got to be tough. That sort of mentality catches up to you. It catches up to the body, and the body needs to be in a balance, and that goes with spirit and it goes with emotional, and that's a way of keeping yourself healthy. The other thing is uh, not to preach or anything, but about that spirituality is it took me so long to come to terms with, to understand that, to have a personal relationship with a power greater than I, like God, or even the traditional elders here uh, in ceremony, the oral tradition, that the healing properties that those teachings have are real, and they're there for us to take if we just take the time to listen and put them and incorporate them in our lives. And we got to take care of our bodies.
Mhm. Thank you, Pierre. I can't see the folks at home, but all of us are nodding our heads with, it is so much more than just taking care of your physical body, of eating well, but that emotional piece, absolutely. And you mentioned, for folks at home, you mentioned Bessel van der Kolk and Gabor Mate, who do a lot of trauma research and how that's stored in the body. So, yeah,
If
thank you for shedding light on that.
if somebody has invaded your body, go deal with that, because your body is no longer yours, and you need to retake that body in order to be healthy. And
Hmm.
and if not, it'll come. If we don't deal with that, it comes out and about in form of disease, in forms that we don't. It comes in a physical form.
Hmm. Yeah, thank you. And I'm glad that resonated for you and has helped you to lean into other supports that we may not think of when we're dealing strictly with illness, right? It can feel very medical, but it's the whole person, the whole all the facets of the person that we need to care for. So
And
thank you
and
for
the
highlighting that.
flexibility of our doctors today who listen to that and who are understanding that and who are shifting in order to assist people like us to heal.
Mm-hmm. I'm glad that was your experience, that there was an openness to understand what would be helpful for you, not just chemo radiation, but all these other things that you're doing to help yourself. That's great. Yeah. I'll shift to Michelle or Julie. Was there anything that you wish you could tell your previous self?
I would say that there is no quick fix when you go through this, and to realize that this is a journey, and that you can have the treatment, and then you have to do the journey of recovery, which is a different path, and to continue to live with this for always.
Mm-hmm.
Yes.
And that a diagnosis is not, it isn't, that's not the end of the story. A diagnosis is a diagnosis, and it can go in very many ways over a very long time. And it's something, I suppose that's where I am thinking about. You have to learn how to go on living with this diagnosis, which was unexpected.
Right. And that it stays with you. It
It
changes,
stays.
but it stays with you. Yeah, that's very wise.
Absolutely. Absolutely. It changes your life.
And having that acceptance or openness to not feel like you need to move past this at a certain point, that
Right.
it is going to change how you operate, how you view the rest
Yeah.
of the time. Yeah.
It becomes who you are. It's a
Mm-hmm.
piece of who you are now.
Mm-hmm. Absolutely. Thank you for that insight. And Michelle, was there anything you'd like to add for something that you wish you could tell your old self?
Sure. I love what Pierre was saying about holding all the anger and the trauma and the just all that stuff. That was me. And I didn't think I was doing it. I, thought, hey, I'm pretty high functioning. I'm doing well. Anybody else out there? I was like, hey, I'm handling life. I got stuff going on, right? You guys are maybe feeling the same way. It's like, what the heck? How did I end up with cancer? But yeah, now that cancer made me slow down and realize all the stuff I was holding on to. And that made me sick, right? That's where that dis-ease came from for me. So like, what would I tell my younger self, or my another version of myself? I think we have this opportunity now to kind of change the future and change the past. And I kind of saw some of that through my working through my cancer treatment. I'm still working through. I would still consider myself like in treatment. Like Julie was saying, this is kind of an opening now. It's like a possibility of realization of what we've experienced and how we've held all this pain and how it's made us sick, like physically, emotionally, spiritually, everything. And so I'm telling my younger self, okay, that stuff's all story. You're making yourself sick. So what can you do differently? How can you handle this differently? And it is about connecting with, I'm going to say the now moment. I'm going to say letting go. I mean, this is way easier said than done, right? Like, I'm still working on this. Okay, we gotta let go of that stuff. We gotta forgive ourselves. I gotta forgive myself every single day. And I gotta, right? I forgive other people now. Something that's hard too, right? But it's kind of like these memories, these things come up, and it's like, okay, center now in this moment. What do I have? All I have is this breath. This is all there is. And in this breath, in this actual moment, I have no problems. I'm not sick. There's none of that. That's a story. What I have when I center myself back into this moment, it's just this moment. It's this breath. Some of you might have gone to that mindfulness session that we had earlier. That's what I would tell my other self. I would tell myself, hey, this is all there is.
Right.
This moment.
Thank you. Well, I see links to what Pierre and Julie shared, and that it really is a perspective shift, right? And that stays with you, that you said you still feel like you're in treatment and processing and shifting how you're thinking about things and how you want to receive or respond to things, and really being attuned to all the aspects and how we hold on to emotions, anger, like Pierre was saying, that can really we can hang on to it longer than we need to. And I'm glad that you're learning how to release and giving yourself permission to do that work. That's great. Okay. Well, I'm mindful of the clock. I'm trying to stay on time. My last question is, what has been helpful? And that could be what is helpful to you now where you're at. What was helpful to you at the start of this, when you first learned of your cancer, when you first came to CancerCare. So if it can be both, or or.
What has been helpful for me is this moment, this time, this place. Julie, what she shared, how she invoked tears, and it's good to cry publicly. I don't know if you guys could see them falling, but I could feel them. And just this little group here, what has been helpful is technology. You got a Porta-Pick here, a little. I don't know if you guys are familiar with that. It goes.
Yep, I have one too.
Oh my God, that's they don't stick their needles all over the place. Minor surgery, it wasn't too evasive. I'm glad I did it. That was helpful. What was helpful is HSC. I lost my dear loving sister Arlette to breast cancer, and oh my God, she donated money to CancerCare, and at the time it angered me because of like I was thinking like this terrible medicine they gave her, it killed her, and I was young, and that was like a long time ago, like more than 15 years ago, and I was upset and I had some anger. And then I go into the hallway of CancerCare, diagnosed with cancer, walking through, feeling down, struggling that day. I sit down, and there's a lady playing the harp in the waiting room.
It's pretty special, isn't it?
And she's playing the harp in the waiting room, and I was her only customer. And there's people who volunteer and present you with coffee and donuts, and other members playing guitar in the hallways, trying to comfort you, and some of them smiling at you and saying hello. Yeah, that's been helpful. And I'd have to say some of the teachings, Aboriginal teachings, the eagle feather, the sage, the sweetgrass, the ceremonies, that's been helpful. And my family doctor out close here, Lisa Monkman, was supportive. A lady doctor, she's the best doctor I've ever had. She's been helpful. And my German Shepherd, who just come to join me here, he's been helpful. So understanding pets. And my loving wife, Jocelyn, who's a retired nurse, that throughout this whole process, remembering everything and going through this, it's difficult. It's good to have somebody there with you. And it's also good to take notes. That's helpful, very helpful. And ask questions. When you go in there, don't leave with more questions that you went in there with. Have a little list, have your questions, get them answered, so you feel good about yourself when you leave that office after you left talking to the doctor. And if there's things you don't understand, clarify. That's been helpful. And yeah, this session has been helpful. Thank you for listening.
Yeah. Thank you, Pierre. I have to agree. The harp is pretty magical. I always feel lucky when I'm here on the same day. It adds a levity to the heaviness of what everyone's going through.
Mhm.
Absolutely.
Yes.
Yeah. Thank you so much for sharing that. Michelle, can I ask you to go next? What was helpful for you?
Sure. I support what Pierre has said. There's something magical about when you're not feeling well and people show that they care through these just ways that you couldn't have predicted. The harp player, the guitar player, the people who greet you. I have to do the note taking too. I used my phone. Thank goodness we have our technology, because I would write in my phone like the names of the staff, and then I would check their names, and then I would greet them with their names, and we would get to know each other. So I found that helpful to make personal relationships with the people, like the secretary or the administration, or like the person who was walking me to my chemo chair. I would hear about the nurses and what their kids were doing, and we would celebrate. We would offer gratitude. I would bring in chocolates, and it was my birthday and I was having chemo. I'm like, I'm not gonna like complain about having my birthday in my chemo chair. I'm gonna bring cupcakes for everybody. We're gonna have a birthday party, right? Like, it's like finding moments of gratitude. It's taking opportunities with all the people that are there to be with. So when I was going for treatments, we were trying to bring some levity to it, like to share the gratitude and the love. The spirituality, 100%. It's like reading those books. At one point when I was so low, I couldn't read, I couldn't watch TV, I couldn't do anything. Right? That's how bad it gets. And then eventually, when you're able to and you're ready, you start taking advantage. It's not a very good, nice way to put it, but you start opening to new experiences and new ways of perceiving and being and doing, and that comes through and that opens you up in whole new ways. So definitely explore some of those resources, helping anchor you into this now. Do the yoga, do the expressive arts therapy, do all these are like considered like complementary therapies. And I would disagree. I would like to see like complementary therapies as the fourth mandatory treatment, right? We had some of these like presenters earlier, and there's radiation and there's chemo and there's surgery. And there's complementary therapies, whatever. Those are that's what helped me, like hugely. I mean, it all helped me, right? You do everything, you do it all. So I'll just end there. I want Julie to have a chance.
Well, that's great. I think your openness to try these things that maybe you hadn't tried before, um, and just to be willing to and to go there to help you process the emotional piece of going through something like this. Absolutely. And can I just say how awesome that you brought cupcakes for everyone on your birthday? That's such a that's such a great spin on what could easily be, oh, what a bummer. I have chemo on my birthday. That's great, Michelle. All right. We'll go to you, Julie. If was there anything helpful to you now
Sure.
or then?
Well, both things, and they're the same and different. But
Mhm.
what was helpful at the time when I was first diagnosed was to realize that I had such solid support systems in my family and my friends who really came across for me, in driving me back and forth to chemo, to bringing me soup that I could eat, to talking, allowing me to talk, and just being there. They were all terrific. And an additional support system, I decided to adopt a kitten from the Humane Society when I was about to start chemo. And it was the best thing I've ever done. I think she is the most delightful little cat. And when I would come home from chemotherapy, she would come and just snuggle up, and she would stay there no matter how long I was sleeping for. So that was very helpful. Now I had just finished the refit recovery for cancer program, and I want to say that is a fabulous program. It is 10 weeks, twice a week for 2 hours at a time with a group. It is wonderful. It's exercise and talk therapy and education was wonderful. And I've always been someone who has exercised, and I think I really appreciate the fact that, yes, I've always done that. And so it has made me healthier and more able to deal with this. But also going forward, you can't go out and exercise and not feel good afterwards. It always makes you feel better, always. So that is something to continue. And one other thing to add is choosing to take positivity, to be positive about something, rather than I very quickly came to the conclusion that I'm not going to choose anger and poor meism. I'm going to choose gratitude. And the gratitude was that all my life I have been healthy and fit. And it's now my turn to go through something that's going to challenge me. And I am going to continue to be very grateful for everything about it. That it has made me actually a better version of myself.
Yeah, I love that outlook, and I'm so glad that that is such a wonderful program at the Refit. We
It
hear
is.
wonderful things, and it does
Yes.
kind of encapsulate everything, right? The
It,
physical, the nutrition, the spiritual, emotional.
yes.
Yeah.
Yes. And just the support from the people in the group.
Hmm.
Yes, wonderful.
Great. Well, thank you all. You've shared such wonderful advice as to what's helpful to you practically for your comforts, for how do you move forward with this after going through something that's such an impactful, life-changing experience, and taking in the supports of people around you, asking for what you're needing, and being open to leaning in and trying new things. I really, really appreciate everything that you've shared. Um, we're going to shift to the Q&A portion if you're ready. I'm not sure if you can see, but I will read the questions out, and some might be directed specifically to one person, and others might be a general. So let's go. All right. I've got, oops. Michelle, you seem very cheerful despite the tremendous battle you must have incurred. How do you do it?
Oh, yeah. Well, let me tell you, like when I was doing the treatment, I was not all that positive. I think that I've maybe come to this point. I would have seen myself as like overall a positive person, but there was a little bit of fakeness to that, right, Pierre? Because it was stuffing, right? We're stuffing all that stuff, and that's what made me sick. So now this like joy or peacefulness or love, it's a different kind of energy. It comes from releasing that stuff, which I still am in the process of doing, but that's where this different energy around myself comes from. This background makes it seem like I actually do have energy going on, but yeah, that's what it is. It's from release. And it is focusing on yourself and your own healing in so many ways. And I was talking about all the things to do, but you know what? You just need to be. I had to learn that because I'm a do. I'm a do all over the place. That's what got me in trouble. I just do-doed everywhere. And I had to take this time to just be and just be with myself and my emotions and my thoughts and release. So that's maybe where some of that happiness and upbeatness and stuff comes from now. It's getting rid of all that stuff I've been storing in myself. And you guys will do it too. I know you will. You will do it too. This will all be released.
Thank you, Michelle. I just want to mention, Pierre, there's a lot of thank yous, my heart's with you, God bless you, and someone else who's resonated with being there with the harp lady. that was a very moving experience for them too.
Wow. Mhm.
Okay. I'm looking for questions. Um,
I'd like to
okay.
share.
Yes, sure.
I can resonate with some of the slogans and previous things I've heard about cancer, and like sometimes they swear at it, and sometimes they're fighting it, and there seems to be some of that anger projected towards that disease. And what I've found is that anger that I have is to be utilized in a good way for the purpose of good. That energy of anger, that emotion of anger, is to be utilized for the purpose of good, and we can convert that in helping our healing. And first and foremost, I have to respect that cancer because it is bigger and stronger than me and more technical. And there's people that are wise that are trying to figure this all out, but to be mad at it is not a good approach. I have to respect it first and foremost, and it stems from the traditional elders when they talk about makwa, that bear, that medicine keeper, the spirit of that bear. Well, they offer dishes to it. They offer berries to it. They offer that respect to it, so it doesn't harm them. Because that bear, if you fight it, it's gonna hurt you. And it's just like cancer. And there's no fighting that. You have to learn to respect it, walk with it, and choose that attitude that Julie and Michelle are talking about. Focusing on self, and the other such a helpful thing was been the support network of friends. Those that matter, those that invest in you, are the ones when you're sick you learn that you should invest in them. And those that are investing in you when you're sick, those are the ones that matter. And all of a sudden you recognize that, and there's these old friends that come out of the woodwork and they bring you soup and bread, and man, that is so healing. That is so healing when people do that, and it's so simple. And that's something that as long as I can live, well, maybe I should be doing that now to other people because it's my turn.
Thank you, Pierre. I really love that image of respecting the bear, feeding it, and how you're choosing to channel the energy to help that anger energy towards helping yourself through this rather than knocking against it. Anyway, I'm kind of
It's not a fight.
stumbling on my words, but the image is strong in my.
This is true. And just to reinforce what Pierre said, I'm not fighting cancer. I've never been fighting cancer. I love my body. I am not fighting. I was fighting, right? I was holding all that anger and fear and whatever energy was causing me all that distress. And now that was my realization, I guess, through this journey. It's I'm loving my body. My body heals itself. I'm letting light fill me. I'm letting the light go to all of my cells, and my body will heal itself, and I will help it to heal itself. It sounds very zen, but you get there, right? You get there with the centering in your own breath and not having problems in this moment. I know there's pain. I felt the physical, emotional, spiritual pain, all of it. And you are able to get to that point where it's a different experience of letting go. Resistance is futile. Let's not hold any more of that anger and the fear and the anxiety. Let's breathe that through and not fight it.
Thank you. Thank you.
Yeah, I agree.
I'm trying to keep track. There's so much gratitude to all three of you for sharing your wisdom, sharing your stories, and people are feeling very inspired. There's a question that I hope you might have an answer for. Someone's asking for the caregivers and loved ones who are attending at the conference. Do you have any advice for them? How they might be able to be helpful, or what to expect, or whatnot? Any advice that you could give to the caregivers?
I think just to meet their friend, family member where they are, not tell them what to do, but bring the soup. Don't tell them what to eat or not eat. Because or how to feel about cancer.
Yes.
Because I think you get, I certainly did, and I think other people have too. People give you all kinds of advice, but they've never walked the pathway that we are walking.
Mhm.
They don't know.
Yeah.
So
Asking
that would
the
be,
person
yeah.
what they need. Yeah.
And just to be there, but to do it quietly and not too intrusively, I think.
Wow.
That's great. That's
That is
very,
great.
and bring the soup.
And very
And bring the soup. Yeah. Yeah.
Very important. Thank you. That's very person centered, right? Not
Mhm.
not thinking of what you think they should be doing, but asking them what would be helpful. Yeah. Thank you. Michelle or Pierre have anything to add to that? Any advice you would give to caregivers, support persons?
Yeah, it's Julie, bang on. Thank you for saying that. But for the caregivers, you have to take care of yourself. You have to take care of yourself.
Yes.
Yeah, you have to take care of yourself first and foremost. And like Julie said, advice and stuff. We have doctors, we have specialists, we have professionals, we got all kinds of information. Please, please, uh, if what you're saying is true, well, you're going to be a rich man or a woman. So you'd be out there healing everybody. So I'm not saying that to be facetious, but just, advice, everybody's got it. And, we're getting that through professionals. So that part of it, we're okay when we're going through this. And like Julie says, it's our cancer, it's our experience, allow us to make the requests that are helpful to us.
Mm.
Very good.
Well said. Well said. Is there anything you'd like to add, Michelle?
It's beautiful what Julie and Pierre have said. That's I in terms of like the supports that are out there, there's lots. Like I had my family attend a Zoom meeting with so that we all had a chance to talk about our own feelings together. So we heard each other. And someone mediated that, I guess. So that was helpful. There's lots of resources out there for caregivers and families, but I 100% support what Julie and Pierre said, that you as the person with the cancer, you'll do what's right for you, and take the time that it takes for you and go through your journey. And it's unique to you. Just because I had breast cancer and you have breast cancer, it doesn't mean we're walking the same walk at all, right? So just allow that. And you're right, Julie, about and Pierre, about just having our caregivers, people who are looking after us, like helping to look after us, they have their own walk to walk as well, and we respect that. And they do or be as they need to do or be. Sometimes those paths crossed in ways that we might not find as helpful. And so there's ways that we can respect or to allow that space to happen is each person goes through their own. Thank you.
And that the caregivers have to find their own support system too, because it is very, very difficult to be a caregiver. And they can't look to the patient to make them feel better about how they feel about you, if you know what I mean.
Yes.
Yes. Yes. And sometimes they want to protect you as well from that. I will just mention for people who are watching from home, if you're not aware, our counseling services are available to family members as well. And we have a caregiver support group. So I just wanted to plug that. But yes, I think that you all bring great points, that it really is about what each of you are needing, patient or caregiver, and especially for the patient to communicate what is helpful, and to trust that they're letting you know what they need, and not to make decisions for them.
Yes. Yes.
Great.
Wellsprings is also great. Wellsprings, if you look up wellsprings.org or com, I don't know what it is, look up Wellsprings. They have amazing programs for everyone, caregivers, patients, who look that up. There's all kinds. I found wonderful things in there about the cancer journey and developing spirituality, sound baths, art, expressive art. There's all kinds of stuff, and as well as what Manitoba offers. So caregivers, family members, friends, they can all get their own support from multiple places and ways.
Thanks, Michelle. That leads beautifully into the next question, which is, were there any resources online, social, professional, community that you found helpful? So Wellspring, shout out to Wellspring. They are awesome. It's in the chat for those of you at home, wellspring.ca. They have a lot of virtual groups that you can join from anywhere in Canada. Anything else that you found helpful in that regard?
What I am finding helpful now is that I feel that I'm in a position where I can give back, where I can be a support for someone, and that has been wonderful. Like an unexpected bonus, actually, because I have gone through this. I can give a different kind of support in how things have impacted on me, and to just listen, not talk.
That's great. That's wonderful. I'm sure the people you are supporting appreciate that. And like like Michelle said, that even though you might have the same diagnosis, your experience is very different. So allowing for that difference, allowing for that space, and that's great. And
what has been
how lovely.
Helpful for me, we talked about some books, and Gabor Mate, The Myth of Normal. That's a great book. When the Body Says No, also very helpful. And peers and friends and family who, when you say no, can accept that and can understand that. Different boundaries. Maybe you're not used to that when you're always willing to jump to the pump for people, and all of a sudden you're saying no, and they find that a little bit peculiar. And to be able to say no in order to keep my boundaries, myself healthy, and to get proper rest, and to take care of myself physically because of what I'm going through. And when you say that to somebody and they don't have a negative response to, like, with a bunch of questions, or you feel you got to explain yourself, or explain to them that you have terminal cancer, like why am I explaining myself to you? Why do I even have to exert that energy, when if anybody else would tell me no, I would just accept that and say, oh, maybe some other time, or that is so helpful when people are grounded in themselves and they're able to accept that. And that's been helpful. People who are mature and healthy, and are able to understand your journey.
Right. They won't take that no personally.
Yeah. Yes.
That's a very good point.
Yeah, and so important, right? Like you have to focus on yourself, and you're not able to, for whatever reason, to always meet everybody's needs or expectations. Even just a phone call or meeting up with someone is too much sometimes.
I'm not a judge, but part of Michelle's journey is at first she was having a hard time saying no, but now she's better at it.
That's beautiful. I'm still working on this. Right now in my journey, I'm transitioning back to work, and my should I reveal my age? I'm in the second half of my life, let's say. I have all of that to figure out a new way of being, right? And so in my transition back to work, I found myself slipping into my old ways, which is saying yes, 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 yes. And so thank you, Pierre, for pointing that out, that yes, I am still working on helping myself, because right, cancer has taught me something for sure about my limitations, I guess, or the way that maybe not limitations, I don't want to say it that way, because we have expansive possibilities. I wasn't listening to my body before. I'm listening more now. So yeah, when things come up, I'm like, okay, I feel that. I gotta step back a bit. And so in terms of resources and help things, people or things that will help, having understanding bosses or family or friends, so that no matter what point in your journey you're at, like if you think you have more energy right now, like one of those presentations was about that, about don't push yourself. You need to notice that sooner and allow yourself the time that it takes. No is okay. We don't have to tell anybody stories about how we're feeling or what we're going through. No, you don't have to. That's draining. All that you have is this moment, and in this moment, I'm doing all right. I have this moment. I'll just be in this breath. I'm good. They can accept that. I can accept that. On we go. Say no.
Thanks. Julie, did you have anything you wanted to add to that?
I'm not thinking of something.
Oh, I think you're muted. Well, I wanted, Michelle, absolutely, you've got to. Oh, there she's back.
That you might say no to something that normally you would have just said yes immediately. I don't think you have to give that kind of explanation. I think that's where we allow ourselves to change a bit.
Yes.
That's great. Yes, absolutely. And Michelle, I think when you were speaking, I was just thinking of the phrase "no" is a complete sentence, right? You don't owe that explanation, because it is draining, and it just gives them an opening to kind of ask for more, or the rationale. You can just say no. That's great.
Yeah.
Well, noticing our time, and I just really want to thank you all. It has been a rich conversation, and I know from just the comments that are scrolling up how impactful it was for people who are listening to your experience and your wisdom. So on behalf of everyone, thank you so much for sharing your stories with us and being so generous. We really appreciate it.
Thank you.
Can I say something?
Yes.
I just like to summarize. I'd say thank you for the opportunity. Thank you for you people that organize this. I'd like to say thank you, and I'd like to pray for our leaders and our elders in the community, and all those who make choices within our medical system, and for CancerCare itself. And we have the wisdom, we have the technology, we have the know-how on helping people overcome this. I'd like to say thank you.
Thank you, Pierre. Very well said. Thank you.
Yes, thank you.